Okay, I think we're going to get started so we can have some discussion.
First of all, are there any questions about the presentation itself? Either for me about Ciclo de Vida or the partnership, or yes?
I'm trying to understand the different players, like what are the Las Angelitas and the Compañeras,
Okay.
what were their different roles?
Yeah, the Las Angelitas is the best practices model.
Okay,
So when I
so
talk
it's two
about
different
hybrid,
studies.
that's the.
Oh, okay.
Las
Yeah.
Angelitas is my support counselor at Ciclo de Vida.
At the community-based organization, that's the equal partner in the research partnership. So
Right, okay.
Ciclo de Vida has half of the funding to do the implementation piece and supervision, clinical supervision, as we do the intervention study, the RCT, the randomized clinical trial. And then UCSF provides all the research staff. So we train on the data collection, doing the interviews, we analyze the data, we kind of drafted all the data collection materials, including all the process evaluation forms, and then we kind of vetted it back and forth.
And Las Compañeras are the women we recruited for the study to
deliver
the intervention.
Yeah, because we wanted to come up with a
Peer
different.
support.
Yeah,
Yes.
they're the peer
No,
support
that's the way we
counselors.
use the language. I have another
Yeah.
project I'm affiliated with, and
Yeah.
there's promotoras and compañeras. So the
Yeah.
promotoras are the angelitas.
Right,
Okay.
exactly,
Okay.
exactly.
Did your study specifically identify women who were lesbian, bisexual, or transgender?
No, we've had some, but we didn't tailor it for that population specifically, but I think it's something that definitely needs to be done. Yeah.
You were recruiting people up to a year from their diagnosis. Did you find a sweet spot as to when individuals are more receptive to participating in a support group?
That's an excellent question. I'll say kind of what I think, and then we might add something. But it was clinically because we're working in public health hospitals almost exclusively. The population, that's not true because we get some Kaiser, but and other providers. But it was really hard initially to get the referrals early on, because ideally we had wanted to be in there like the first 1 to 3 months, because of Carmen's experience in her organization, wanting to get people early. But there were also women, having said that, said this is overwhelming, I can't do it right now. And so we came back to them, and then they were willing to do it. So one of the things we're hoping, because I think it's a key question, and I don't think we really know what the best answer is to that, is that we have people that at least got it early on, and we have the time, since diagnosis that they initiated the program. And then we also have the waitlist people, and about 33% of the people that are in the waitlist are opting to take the whole program. So we'll have people that took it later in the process, and so we can see if there's any difference in terms of the process stuff, the evaluation, as well as the outcomes. So it'll give us some handle on it without doing it in a structured, kind of systematic way.
You talked a little bit about the cultural adaptation process. How did you choose the cultural movement method? Can you talk a little bit more about that?
The cultural adaptation process.
We looked at Ciclo de Vida's model, Las Angelitas, and we took aspects from that model to include into the intervention. For example, I feel that early intervention is really important. I developed a program at San Francisco General Hospital, as I mentioned, that a peer support counselor, me, is there, and I go in with the doctors when Latina receives the news of her diagnosis. So they do whatever they need to do. They leave, and they leave me with the client. So I'm there from the very beginning. And then I assign her to one of our angelitas who will do the home and hospital visits, who will be with her throughout the whole process, from diagnosis through surgery, through treatment, through recovery. So I feel that the earlier you intervene, the better for the client. I feel that the client will experience less distress, depression, if you begin providing those services at the time of diagnosis or shortly thereafter, by someone who's already been through it. And so that's what we were hoping to accomplish in our intervention, is to do that early intervention, but we had some of the problems that Anna mentioned.
And there are a few examples but there's not very much written on the steps, like when you do the cultural adaptation, and that's why we kind of presented those 6 steps. There's an article, and I'm blanking on the person's name. It was an HIV intervention that they adapted for Brazil, delivery in Brazil, and that's one of the best examples I've seen of people actually writing up a process for it, because other people will kind of share anecdotally what they do, but so there's not a lot to go on in terms of the evidence. I'm writing a paper right now that I think will hopefully get published soon, where it looks at the broader issue, kind of taking these evidence-based interventions and trying to translate them into community settings. So it's a little bit broader than cultural adaptation, but it's more a step-by-step thing, and it refers you to resources. So the cultural adaptation piece is in there, but I don't do it. I just refer people. These are the people that have done it. Where there's Burkio is his last name, I think, that guy. Where people have done it, and there are examples in the literature. But we need more writing like that, more articles out there, and more technical assistance resources out there for doing it. I agree. And a systematic evaluation of, does that produce a better product and better outcomes? Okay, so let's start with exercise. So who wants to talk a little bit about the purpose of their dissemination activities? What is their intent with disseminating some of the things they're learning in the field or with the research project? How do you do it? Why do you do it?
Anything different from what Anna presented that you're doing?
Why is it important to disseminate?
We have a program that is sort of wrapping up to look at mammography among Latinas, improving mammography rates in Latinas, and we're thinking about doing a newsletter, like you said, back to the participants, because we've really struggled with recruitment, even though we're using promotoras and going through a local community health center. It's still been hard to get women to agree to participate, so we want to sort of again, sort of acknowledge what they've done by being a research participant and their contribution to society. But we're also thinking about having some sort of like fair or festival at the end to present the findings.
That's
part of a
great
larger
idea.
project that has actually like 5 research projects related to Latinas and breast cancer. So we were almost thinking of having sort of like a fair event for all 5.
Right. I wonder if we could get like a conference planning grant, from someone and make it more, but you could make it fun too, right?
Yeah.
Where you could attract community as well as academic researchers.
That's what we were hoping, was that it wasn't the community would more be the audience,
Right.
or maybe even like healthcare providers or practitioners as the audience in terms of what we have learned about.
So if I understand you, you're doing that because you want people to feel valued about their participation and promote easier participation, more community engagement in the research process after. Anything else? Any other reasons you would disseminate?
Well, let's see, my population interest would be Bay Area injection drug users, and part of the dissemination process would be hopefully fostering a community, gathering people in one place and doing it verbally and kind of interactively, as opposed to making newsletters great in some
But more like a
contexts.
town hall, possibly the town hall.
Probably
where people
smaller and more
contact.
intimate than that, maybe not everybody receiving the data on the same day, but like having kind of like a little ice cream social or something.
And what would be the purpose of that? I mean, what would you hope to
Oh,
come
what
out
would
of
be
it?
the purpose of
Yeah.
community is, community is incredibly important in health outcomes among injection drug users. For example, if you're not alone when you overdose on heroin and somebody has an Narcan, they can, that's just one of the,
Right.
the benefits of social linkages and ultimately self-esteem, and self-esteem is connected to getting off drugs.
So really understanding the context of why, what the issues are, right?
Right. And just as we saw in this morning in the Chinese restaurant workers, the dissemination process there unearths more data. And that wouldn't necessarily be the goal of this particular dissemination activity, but I like
But it happens.
the sort of interactive and
Yeah, it sounds like a great model, definitely. So who are some of the audiences that you would be disseminating to, that you think about when you think about your research, your program activities? Who needs to hear about the value of what you do or what you bring to the table?
Well, I put down 5 different groups because, and I'm thinking of this work that I'm just starting. But so I was thinking of the farm workers and then clinicians who care for them, and then policymakers, researchers like these folks, and then any community-based organizations. And what I disseminated would look different to the different groups. But to the first answer, to the farm worker population, I was thinking, and it's been reinforced this week, is speaking from a strengths perspective to people, and helping, like, how important it is to include the people that you're asking questions of in the dissemination of the information, because it's just as important for them to understand how clinicians and others think about their healthcare needs as it is for us to understand how they think about their healthcare needs. And a lot of times the populations that I work with really aren't ever oriented to our healthcare system, as even though it's not a system, but anyway, they're not oriented to our fragmented way of caring for them, and don't really understand the starting place of the person who's in front of them.
Yeah, it seems, I mean, I've always found that sometimes we make a lot of assumptions, right, about what the other players want to hear, or what they think about each of the respective players, right? I know, I've had community people tell me, oh, you're a researcher, you're funded to write grants, and I say, no, I'm not. I don't get funded to write the grants. I only get a salary if I get a grant. So all this help is, I'm doing it because I believe what you're doing, a lot of it. So it is, there are, I think we've learned a lot about each other and what we do.
So I think maybe research funders might be a good target audience, right, for your work. Let other
research community in
funders
general.
know what you're doing, and
I
The
think
medical
that's,
community.
yeah, I think people think health disparities are only relevant for health disparities communities and health disparities researchers, but it really gets at issues in terms of social equity and quality of care that are important for all populations. And access, exactly. So you're right, we need to reach some of those mainstream audiences as well as our kind of tailoring to the people that we know are already kind of part of the choir sometimes, or on board. So what are, I know some of you have already touched on this, but what are some of the lessons you want them to take away from what you're disseminating? When you think about it, what is it that that you want them to remember and apply down the road?
The one for me would be the assumptions thing on both sides. Assumptions of need versus expressed.
That's a good one. That's a really good one. Any others? Anybody else?
I would say the challenges of recruitment, and just kind of the vision of where the research is headed, or where the project interventions are headed, and really kind of involve and highlight that collaborative piece that they could always, after they hear the results or the issues or whatever you disseminated out to them, that they could always be part of that, that they're always welcome to be part of that conversation, that it wasn't just a one-time thing,
Right.
that it's an ongoing relationship.
And providing maybe a platform to do that on, with
Yeah.
presence or.
Did you hear that comment? And maybe providing a platform to do it, right? Unless you give people a way to voice their participation, it doesn't happen. So you have to be
What
really
we've
aware
done
of
with that is, the platform, or what we're working on, is creating like a community advisory board that's made up of the targeted audience that everybody just mentioned, but really kind of something that I've learned from this institute is really kind of strengthening the community resident piece, making sure that they're strengthened, that they're confident that what they bring to the table is going to be very valuable.
And how do you do that?
That's the $1 million question. I think that having bicultural, bilingual facilitators and moderators, we think compensating their time is really important,
Okay.
making sure that if they know that we value their time is very valuable. A lot of our community participants and previous study participants were day workers, day laborers. And so our meetings were Fridays and Thursdays from 11 to 1. And even the Board of Supervisor was excited to come for lunch. Like, you know, our participants aren't excited to come for lunch if they're going to take off their whole day.
Right.
Work or daycare. I mean, just really facilitating that whole process to make sure that it's inclusive and that their voice is really valued. And
I'll tell you, one of on our monthly conference calls, our idea for our next project came out of one of those calls where we asked the recruiters and then interventionists that are on our current project, you know, what do you see as the salient issues for Latinos once they get further out in the trajectory, right? Once they've been diagnosed and you know, gone through treatment and everything, what are their longer term survivorship needs? And you know, and they came up with all these issues that they were seeing the clients have on an ongoing basis. And so we wrote a proposal around that, and luckily it's been successful. But you know, don't overlook your partners. They come up with great ideas, you know, the community folks that are in the trenches delivering it. You know, and I think it says a lot for how we value the input as well. You know, we gave them a channel, we gave them the conference call. You know, not all of them show up all the time, but most of them do pretty regularly, and we really ask a lot of questions to try to get them to flesh out what are the problems with the program. You know, we don't want them to sugarcoat it and so forth. So, what's the best way to convey that information for each of your audiences? We talked about these smaller kind of informal kind of fairs. We've talked about conference calls, scientific publications, our guia that went to the CBOs, and possibly doing a policy briefing. Any other ideas about how you would disseminate some of these messages into the respective audiences that you're targeting?
I was thinking of perhaps doing like a digital story around it, like video that you could.
That's what I wanted. I would love to do that.
Right?
Yeah, because like we get those little clips, right? But to really go in, I wanna. This is what I want to do because I'm excited about it. Is I want to get like a researcher, student, to go out with a video camera and interview the people that have gone through it and the people that have delivered it, and just do that, right? Make it more a story.
And then if not enough money for that, I was thinking also like a storyboard. Like I've seen a lot of like storyboard like brochures that.
Advertising people do it all the time.
Yes, like it's more effective sometimes than reading a lot of text about what you found if you show it.
Right.
You know.
Yeah, we found you can do, MCN, my organization, has done this a lot recently with some of our younger staff. They just take their iPhone, you don't need a video camera.
Right.
You know, that's like last decade. They just take their, you know, and they'll just talk to them, and then they'll edit down, you know, 1 or 2 minutes, and it makes a really powerful little thing that you can upload on your.
I went to an NCI meeting a couple of weeks ago, and they had different because they funded these community projects, and one of them, it was just so effective. It was to promote colorectal cancer screening, and she was Vietnamese, and she was trying to reach, you know, those people that don't get screened in these newer communities that aren't targeted by a lot of the public health interventions, right? And so she comes out and she goes, you know, she tells a little bit about her, literally a minute, and she says, you know, I'm a medical student, and this is my message for my mom, because they wanted them to create a message for their parents. And she goes, Mom, you know, I'm in medical school, you know, I'm living the values that you taught me. I want you to grow up. I want to grow up and have kids, and I want you to be a part of that. I want you to enjoy your grandkids. You know, and she goes on, I want you to see me graduate from medical school. I want you to see me as a doctor, you know, and she goes, and please get your, you know, colorectal cancer screening because I want you around. You know, and I mean, I get that 1 minute thing because I was crying. We were all like almost crying. But it just touches you.
I mean, in that same vein, you know, the project had a YouTube channel, you know, in which stories were uploaded from the phone, and you know, potential participants could look.
Right. Excellent ideas. I mean, I think there's so much potential to do it visually and you know, auditory, using stories that we don't tap into. You know, I'm you know, we publish these scientific articles. You know, now we did a guia, but you know, there's so much more. I think your ideas are great. Any other ideas about dissemination?
You could do it game show style. Like pick emergent themes and
Right.
do like Hangman or
And I bet people are more likely to remember the messages, right, that way.
Yeah, there's an organization here in the city who does a bingo, which is part of the Latinas Contra Cancer too, and it's on early detection on breast cancer, and it's a bingo game.
Nice.
It's pretty,
And it's educational
Yeah.
and gets them involved, it's fun.
And it's fun.
Something that's culturally, people play bingo, they know everybody knows bingo, so. Any other ideas to wrap up, I guess, because I think we're running out of time, and I don't want to keep you, but any last words?
Thank you.
Well, I just want to say we're available if you have any questions, I think they probably have our contact information hopefully in the bulletins. I should have put it on the slides, but I didn't. But Círculo de Vida has a website, a beautiful website, you can just Google, and I'm available through the UCSF directory. You can just plug in my name and my contact information. So thank you all.
Thank you.
Thanks.